And Thermi RF is a radio frequency that is used to help tighten tissues and sculpt the tissues. But it's mostly for the patient who does not want surgery, any type of invasive surgery. They don't want it, they don't have a candidate for it, or they're afraid of it, whatever. But they do want something. So it is a niche that works very well for a certain subset of patients. What that essentially is doing is through very small needle holes is placing a probe that comes in along here and along the neck, where we actually heat the tissues up underneath the skin. That heat causes the tissues to shrink and tighten up. It doesn't happen immediately. It takes 3 to 6 months to see the result, and those results can be significant enough that they're going to be happy with it. It's not meant to replace a facelift, but it does work well in a younger patient that has a little excess skin, a little excess fat underneath their jowls and neck. Now we do it in other areas too. Some of the rolls, back rolls, some tightening of the skin of the abdomen, knees, thighs can be done as well. It can remove small amounts of fat, particularly right in this area to help shrink up some of the fat. But it's not meant to be a fat reduction technique. This is a technique that can be done under local. It just causes the patient minimal discomfort. It takes 45 minutes to do this area, which is typically where we do. It's done through putting some local in the tissues. I put the probe in there. It takes about 45 minutes. They wear a support garment for about 2 or 3 days. May have a little pain, a little bruising. Usually within 5 to 7 days, they're basically all back, doing everything they're doing before. Someone who has poor skin elasticity, someone who has got a lot of fat, it is not a good choice. It's for someone who has just a little bit of jowling, a little bit of loose skin here to help tighten up and define the jawline.